Hiya, welcome back to my channel. My name is Minerva and today I'm going to be talking about what is ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental condition that affects between 3 to 5% of the population in the UK and in Ireland. It means that you have exceptional difficulties with inattention, hyperactivity and impulsiveness. What do we mean by inattention? So that means having difficulty focusing, might appear to be daydreaming a lot, and having difficulty with concentration. Hyperactivity means that you're very on the go, might be quite restless and have some trouble sitting still. Impulsivity refers to the inability to think before acting. So for example, if in a classroom, if a teacher's giving instructions for a science experiment, before they've finished speaking, that you might already be out of your seat. Or if someone's speaking, you might already interrupt them, or you might shout across a room just because you have already got something to contribute, or you already have an answer. You're acting on impulse. These three main areas of difficulties will affect across all areas of your life: school, work, community life, family life, and typically the person with ADHD has no control over them. Like dyslexia, ADHD is in no way related to intelligence. So you can have ADHD and be perfectly intelligent. There's no impact on that. So how does ADHD actually present in real life? They might struggle to stay on task or be unable to maintain concentrated effort on a task. They might appear lazy or disinterested in tasks, in work, even in conversations sometimes. They might appear very forgetful or disorganized. They might not finish their work. They might have homework or even job work, professional work due, and it's just not done. They might miss instructions, even if instructions are clear, and they might need instructions repeated to them several times. They might talk excessively and they might jump from topic to topic quite quickly. They're very restless, very fidgety. You might find them up and out of their seat very often, which might not necessarily be so bad in a workplace setting, depending on what the work is, but certainly in school it can be something that's very, very noticeable. They might struggle to wait their turn. So even if you have a child, for example, that you suspect might be ADHD, and you know they're a very kind person and they were, you trained them up to, take turns to share their toys, but they actually struggle with that a bit, to wait their turn. They might shout or interrupt with a response to a question that hasn't been finished yet, or to give their own thoughts. ADHD is one of those conditions where sometimes, because there are other conditions that present with similar symptoms, like conduct disorder, for example, or emotional upset, it can be hard to differentiate what's ADHD from something else. There might even be a little bit of bother differentiating from someone who has ADHD and perhaps someone who is genuinely lazy. The big difference between ADHD and general laziness is that this is fundamentally a lifelong condition that presents right across at different areas of life long term. It's not going anywhere. Whereas someone who might be lazy could be sufficiently motivated to participate or to get involved with things and not possess those kind of issues. Within my professional experience, ADHD, and I've worked with children, teenagers and adults, as I've said before, ADHD presents the worst in school, and it's very, very difficult, and it's very, very obvious when their symptoms manifest. So for example, as I gave the example earlier of the science class, if a teacher is trying to set up people for an experiment and is giving the instructions, but someone with ADHD is already out of their seat and grabbing materials, or something like that, without listening to the full instructions, there's always the issue, or there's always the risk, I suppose I should say, that someone may look at a child or a teenager, maybe hasn't got a diagnosis, and sort of thinks it's a behavioural issue, it's defiance behaviour. There's always a bit of a concern, I think, in those kind of cases there where you have a student who is disorganised, or who is shouting out in class, or who is constantly out of their seat, or who is very restless and fidgety, or is struggling to stay on task, maybe is not getting their work done that needs to get done in class. It's exceptionally hard then, I think, in some of those cases for a teacher to differentiate between, okay, is this someone who might be exhibiting signs of ADHD or something else, or is there actually behaviour issues going on here, or something else even going on under the surface that we don't know about. So I think school can be very, very challenging for someone with ADHD. When you get older, ADHD doesn't recede in any way. It doesn't go away when you get older. But from my experience, I think it gets better because the environment around you gets better. And what I mean by that is, so let's say, for example, a teenager in school, they might have to ask permission to be out of their seat or to go to the bathroom, or depending on the school's rules. Where if you're in the workforce, generally you're allowed to go up and go to the bathroom whenever you want to. Generally there's a little bit, well, it depends again on the workplace, but there's a little bit more flexibility and leeway between like getting up to have a quick conversation with a co-worker or a colleague, go back down to your task. So I think there is a bit, even though it is still, maybe you might be in one position, say at an office job, at a desk job, for 8 hours a day, there is that more maneuverability, flexibility that a school does not offer you. Yes, there are still rules and things in an actual job, but it tends to be more relaxed in the sense that there's the expectation that you'll behave appropriately. There is also the opportunity for someone to get a very active job. So maybe a job that keeps them on their feet a lot, or a job that gets them talking to different people a lot, keeping them stimulated, keeping them interested, keeping them on the go. Or perhaps a job that requires a lot of physical energy, like a sports job or something to that effect. So it is, again, easier in that sense. Certainly what I found is that a number of ADHD pupils much prefer practical subjects where they can move about, like PE, like home economics, like art or music, for example. Issues with disorganisation and completing work can still remain as an adult, but some adults find it a bit easier because compared to their school lives, they have, now it depends again on the job, they have far less to try to focus their energies on. So for example, someone here in third year, so that's a student aged 13 to 14, might have between 14 and 16 subjects to prepare things for, to revise for, to undertake. And going from having that to then obviously having to work very intensely for 8 to 10 GCSEs and maybe 3 to 4 A-levels in the coming years, versus here's your one job, here's the task that you have to do, and maybe you don't have to take that work home, in contrast to homework for a school. So some people do find it better as an adult because the environment around them allows them to focus more energies. It allows them to do a more active or practical type of job. It allows them to, within that job, get up as necessary for a wee walk around for a chat with someone, or the bathroom or the vending machine or whatever it is. Now that's just within my professional practice, but I do know that there are adults who still struggle with ADHD as they get older, and that might be a cause because of, maybe they want a more complicated job. Maybe they have additional responsibilities such as a spouse, children, a pet, whatever it is. And obviously there are things you have to keep organised within there. Trying to socialise and have a social life, trying to stay healthy, trying to keep on top of life's many responsibilities and duties can be very, very complex. There are medications and therapies and even life adjustments that you can make to support yourself if you have ADHD or your child has ADHD. But this is just a basic introduction to ADHD, so that will be for another video. So that was just a basic introduction to ADHD. I hope the information was useful. As I said, I will go into more topics with greater detail on ADHD and the different ways it affects life and strategies and things like that. But we'll leave it there for today. And you take care, and I'll see you again soon. All right? Bye-bye.